Hello, everyone. Today's live session is with Dr. Charan. We'll be going over the various kinds of mental ailments. As we know, 10th October was the World Mental Health Day. So this Insta Live is going to be created with the hope of educating our youth about various kind of mental ailments and the steps that we can take to avoid them. And we'll try to get him on the call here. Hi, Dr. Charan.
Hi, Nishi. How are you doing?
I'm doing good. Thank you. Am I audible well?
You are very clear.
Okay, sounds good. How are you doing?
I'm doing okay.
Did you have a good day?
Good, bad, and ugly, all the things.
Yeah,
Well, that's how life is, I guess.
yeah. Are you doing like, do you go to the hospital for a certain amount of time, or do you stay back home and do private consultations?
So I'm at hospital till 4 p.m. and come home at 4 and 5. From 5, instead of going to my clinic, I take online calls now, thanks to the pandemic.
Right. Yeah. You've been at the front line, right? So thank you so much for that. I think we have so much to thank our doctors for really helping us get through the pandemic.
Thank you. You're most welcome.
Awesome. Okay, so I'll go ahead and get started here. So hello everyone. My name is Nishi and I'm a founding member of Project Launchpad. And what we are trying to do through this initiative is really talk about the various kinds of issues that our youth faces, but may not necessarily be talked about. So we have three verticals. The first one is mental health awareness. The second one is financial mentoring. And the third one is career counseling. And through today's conversation, we are going to focus on the mental health aspect of it. I think we are very aware that, as youth, there's just a lot that we're going through right now. A large part of it is through social media, the kind of impact that it's having on our lives. Another large part nowadays has been because of the pandemic. A lot of us are very uncertain of what the next step is going to be. Whether we'll be able to pursue that degree we had set out to do, whether we'll be able to travel abroad and, start off the next degree. So there's just a lot of confusion, a lot of uncertainty, a lot of fear with what the next step is. So as Mental Health Day was, 10th October, we're having this entire week of quality content that we're aiming to provide you, things that are backed by research. So the post that we put out yesterday was by Mount Sinai. The next post is going to be by Harvard Medical School. And really the point here is to provide you information on how you can treat mental illness. How basically you can have, I guess, preventative care, like a routine established, like, or maybe just an awareness, set into mind. Absolutely, I think these are very complex topics. And someone who's an expert like Dr. Charan, I think, would be great to consult if that's the stage that you think will benefit you. So what we're trying to do here is to educate, is to provide information so that we gain literacy on mental ailments, just like we do about, let's say, common cold or fever or headache. I think we need to break the stigma and on talking about mental health, upon what is depression, what is anxiety, or how can I take care of myself through it. And then I think along the way, I know I briefly touched upon it, but also we want to make it, I think, accessible, make it affordable, make it normal to seek consultation. to be able to reach out to someone like Dr. Charan, who is, specialized in this. He's studied this. He knows what's going on, and he has the tools to be able to help us. So we also want to make therapy as an option that people should definitely consider.
Yeah.
Awesome. So with that, I'd like to introduce today Dr. Charan. So Dr. Charan has an MD in psychiatry and an MBBS degree. He's currently working as a consultant psychiatrist in Kim's Hospital and has been utilizing the digital media platforms like Instagram to spread awareness on mental health topics. So welcome, Dr. Charan, and thank you for taking out time to chat with us today.
My pleasure. Thank you.
All right. So we'll start off by understanding the basics. So what are some of the mental ailments that the youth of today faces?
See, that age group that we're talking about, when you call youth, I'm talking about adolescence, right? Early, late, or late childhood to adolescence. That's the age of lot of hormonal changes in our body. So a lot of biological changes happens to us. The way we socialize, the way we think, the way we perceive things, the way we start looking at the world slightly changes. Not slightly, actually, largely changes as we aging from childhood to the adolescence. Considering it's pandemic, I think definitely it's even more difficult because most of us we evolve, right? Our personality changes in the time of adolescence, right? Based upon our interactions, we tend to imitate the people that we like. We tend to imprint upon some like you somebody who is your idol, etc. But now, if you put all the youth in a room, asking them not to step out because of pandemic for their own safety, we are seeing a lot of deterioration in their mental health. No prizes for guessing. You already mentioned about anxiety and depression. That's definitely high. And the third thing is, we are also seeing a lot of kids having substance abuse, drug addictions, right? Led by alcohol, smoking, nicotine, or cannabis. Cannabis is very widely used because there are also a lot of myths about cannabis. A lot of people say that it's very good for your concentration if you're not able to focus. It's easy for youth to probably buy a cigarette and light it up than convincing parents to go and see a mental health professional, especially in a country like India. At a point, it's unfortunate to say that I think parents would be okay if they get to know that their son or daughter is smoking a cigarette. They might think it's just age related and it's gonna die down. Versus if they say, I'm going and seeing a psychiatrist or a counselor, they'll be more disappointed in that fact that they're in the place where they need help. So I think as a community we need to build awareness and change how we look at mental health conditions because they're not very distant anymore. A lot of us are facing actively, like me personally, I had clinical depression in my adolescence. Nothing was really wrong with my life. I mean, again, there's a myth that something has to go wrong in your life to have clinical depression. That's not true. It's a biological, organic disease that can happen because of multiple factors, which can be precipitated or triggered by a stressor in your life. But understand, not everybody who has a stressor develops clinical depression. Not everybody without a stressor do not develop clinical depression, right? So I want everyone to look at these conditions as not phases or not some reaction to a stressor, but as medical conditions. I think that's when you can normalize it because no one has shame or guilt in saying that I have I have a common cold or I had malaria or had tuberculosis. In fact, you tell more people to get to feel validated about your disease, about your suffering. If I have tuberculosis, I would tell everyone that I'm suffering from tuberculosis, and people would try to be more careful around you, and they'll help you with whatever they can, etc. So you feel supported and validated in many ways. When you're saying that you're having depression, they immediately There are eyeballs looking, rolling, saying that, what is wrong with his or her life. Parents are working hard to take care of these kids, and what is this depression? I heard many people say this, including doctors. Doctors' children also go through shame and stigma, unfortunately. Um, so I think a lot of mental health conditions for sure. Apart from mental health diseases, there are a lot of behavioral symptoms that we're seeing youth go through in the pandemic. One is obviously irritability. We always think that, oh, he or she is being a teenager. But understand, that's not very normal. If you're seeing your child suddenly is being irritable, being very moody, don't normalize it. First, try to understand what is the reason. I'm not saying drag them to a psychiatrist, but at least talk to them and understand what's bothering them, right? Especially if it's something persistent. Like once in a blue moon, throwing a fit is normal. I do, I'm sure you do too. It's very, very, very normal. But something very persistent, something that is causing a ripple in your life, I think that's something that you need to be very aware of. And we're also seeing people with a lot of inattention. They're not able to focus. It's very difficult, if you have to. For example, me as a doctor of this particular age, um, just to see patients for 3 hours. I see online patients from 5 p.m. to 8 p.m. I get so tired. I can see patients in my hospital for maybe 8 hours. I won't be as tired, but using screen exhausts my eyes, my neck. I feel very tired doing this, but it is what it is. That's what the job demands right now, so I'm doing it. The same way, if you're asking these kids to learn from morning to evening, via online portal, and also give examinations, again, they'll switch from one screen to another screen. They'll probably watch TV or play a PSP, or um, use Instagram or YouTube, whatever it is, right? Again, they are hooked on to the screen. So the social interaction skills and the communication skills are definitely going down for these kids. So I think, I don't know if I covered everything, but more or less, I think these are the things that I'm seeing youth go through majorly.
Yeah, makes sense. I think what you mentioned right there are definite things we've been reading in the newspapers, just being, I think, aware about, because, like you mentioned, you don't necessarily have a compass when you're going through these years. You're so impressionable. You're so just, I think, sort of at the mercy of things that are happening around you. So I think that's when we need to be educated about what the different kind of ailments are. And we need to sort of have some kind of an idea about how we want to deal with them. Like the example you gave about common cold, right? We know them. We have, in fact, off-the-counter medicine that so many times we just go and take, or we steam, and we have our mechanisms set in place. But we're so blank when we hear someone has depression. Like, what do I do? Or, how do I confirm that? Or, what is the next step? So yeah, hopefully we can provide some quality information through this session. So a good segue into that is, what are some usual preventative measures that a person can take? And I know that this is a complex topic, especially when we talk about medical research. So I think speaking about it in light of just day-to-day routine that we can set up to sort of prevent any of these things, which could be prevented.
See, we all take care of ourselves a lot, trying to build up our physical immunity, isn't it? We try to expose ourselves to a little bit of infections. Sometimes we eat out, which is okay, right? When parents would say that it's okay, let him eat out, he'll develop gut immunity. It's normal, right? So the same way, there are different ways that you can do to develop your mental immunity as well. It's not a proper terminology, but I'm saying it so people can relate and understand what you can do to develop mental immunity, in terms of how can you probably prevent having a mental health condition. First, the most important thing is sleep here. Collectively, we as a society, we are not sleeping. I can most assuredly say that. As a kid, I used to sleep at like 8:39. I was made to sleep by 9. But now when I'm hanging out with my married friends and their children. The kids also hang out with us till like 1 o'clock and 2 o'clock early hours. It's not just one family. I can like almost every family that I go to. Understand that you are totally disrupting the biological clock that is present within your brain. Brain also has a clock. You are supposed to synchronize the outside clock to your brain, the brain's clock. That's when sleep disturbances won't occur. Now, unfortunately, because of whatever reasons, we tend to stay up. Even if you open this app called Clubhouse, right, in the night, the whole world is up and they're talking on Clubhouse. They're talking about such burning topics and exciting topics. People are doing everything to stay up. People are always finding different apps or different ways or different people to stay up, right? I think the most important thing is to sleep, stick to a schedule with sleep, especially. And there are many do's and don'ts around sleep, like do not take caffeine, do not take any carbonated soda, which has caffeine probably, and absolutely no smoking, and no using screens. The screen that we're using, you can see my skin is glowing. That's not my skin. That's the blue light from the screen. This blue light can retard the secretion of melatonin. Melatonin is a signal that it's a hormone that gives a signal to brain that hey, it's time to sleep. When the blue light is retarding its formation in the brain, you're never going to get the signal. That's why you don't know when to fall asleep. For somebody who doesn't use screen so much, let's just say my parent, they don't use screen as much. They feel sleepy at particular point. But us who use screens a lot, we go to sleep because, oh my God, it's 2 o'clock in the morning. Let me sleep. I have to get up early morning, right? So the natural signaling mechanism is gone. So our body and brain are built in a certain way. It's supposed to function in a certain way. We are altering the function everywhere. It's like you introducing virus into your computer and trying to clean it up with a Trojan antivirus program. It's not going to work. Basic thing is to protect your brain. So give it proper rest. Very simple things, right? Proper rest is only by sleep. No napping in the afternoon. Some people tell me that, doctor, collectively I sleep 10 hours. When I ask them how many hours do you sleep in the night? So no napping, absolutely no napping in the afternoon. Exercising should be in the morning. Honestly, if you, I don't know, I mean, if you lived in India before, when you go to a gym, gyms are packed in the night. When you go in the morning, they're empty. So a lot of people choose to go in the night, not in the morning. There's a myth that, you would fall asleep if your body is tired. That's not true. You are exercising to secrete endorphins. These endorphins keep you up and awake and alert. They don't let you sleep. They are supposed to keep you up. They're supposed to help you work better in the morning. So work out in the morning. Don't work out in the night. Eat at least 3 hours before you go to bed, because the food that you eat has to digest and reach the brain. The brain has to feel nourished before you go to sleep. If I'm eating at 11 o'clock and sleeping at 11:30, food hasn't reached the brain yet. So you will tend to probably wake up in the middle of the night and might find it very difficult to sleep. Right? There are many things that you can do to fall asleep. So establish a proper sleep hygiene. Second thing would be, um, get exposed to stressors. It's okay. Understand that stress is real and it exists around you. Just like I said, if you eat out, sometimes that's how you develop gut immunity. Understand this is stress and this stresses me out. Don't shield your kids till they're 17, 18, saying that there is nothing called stress. We're going to take care of you. And 18, put them out on their own in a world. Let's just say you're sent to a boarding school or a college, then they don't know how to deal with stress. So probably they'll see what other kids are doing to deal with stress. If I'm seeing my friends, bunch of them are like having fun by like lighting a joint. I'm saying cannabis joint. This kid would do the same too. That's what is happening. So expose them to the idea that there are drugs. These are the functions of the drugs, and this is how they affect. Or take them to a doctor, just to get educated, because we don't have that system in India where you go to a doctor to find out about the preventative measures. People only will come to you when it's too late. Usually that's the pattern here. Or some people are too paranoid and they come like very, very early. But I would say come very, very early than very late, right? Educate your kids about importance and existence of stress and how it can affect you, and tell them that you're available whenever they feel stressed, instead of hushing it, or buying them an iPhone and saying that, are you happy now, are you going to be okay? No, iPhone is not going to cure depression. So having open communication and helping your child, um, firstly, I think you have to set a good role model as a parent, because your adolescents, your teens, all your kids, they observe how you function and they behave the same way. Maybe via genes, or maybe because of just the observation of the environment that they are. Like if you're having a fight, with your husband or with your wife, or some tiff in your office, how you deal with it, your child observes. If you're somebody who is just breaking things and getting very irritated and yelling at everybody, the more chances that they would do the same, the odds that they would exactly do the same. So, I think simple things like that are very important for preventative measures, and definitely exercise, going for regular mental health checkups, like at least once in a year or two. I think a lot of IT companies are also coming forth with taking in psychiatrists. Like I'm associated with many IT companies. They come and they're paid, they're sponsored to come and see me. So it gets a little easier. So things are slightly changing. I think all these things will collectively should protect your mental health.
Yeah, I think some great points there for us to follow. Um, all right, so I think now moving on to how we can, as a society, um, sort of deal with this. And more specifically, I'm talking about, let's say I, as a friend, see someone who's not doing well, and I really want to help them. But how do I go about this? And I think just this is tying back to, earlier in our conversation, we talked about if someone's having cough, then we say, hey, do you want us to bring you food? Do you want us to bring you any medicines? I can cover for your work. So what are the appropriate things that we can do when we see someone who's not doing mentally well?
I think the most important thing is to ask and listen, because everybody copes up very differently. Like me personally, if I'm feeling depressed, I would like some time out from people. I would like to process myself, process my thoughts, and get better on my own. But I would still like people extending support in terms of being there, in, if not immediate environment, being there around me. But some people actually want someone next to them, take care of them. So ask the particular person, what he or she would like you to do, and take genuine interest in it, rather than shushing it away. A lot of us do that. It's okay, it's going to be okay. Let's just go out, have a drink, or let's just go dancing, or try to set them up with, a partner, like a rebound, especially somebody who went through heartbreak. I think all these temporary measures usually fail miserably. You're supposed to understand that, this could be a mental health condition, right? Ask them, first of all, you gather the enough data for you to know that, probably something is wrong. Ask them, talk to them, and tell them, should we go and see a doctor? I'll come along with you, right? Should I book an appointment? In physical health conditions, you do the same. You immediately like call like a diagnostic center, ask them to come and collect their blood test. So immediate, so quick to act, isn't it? Uh, it's the same way. Mental health condition is even more dangerous in terms of its brain. Brain is the master organ of your body. We tend to take care of our brain the least. We take care of our liver, we take care of our heart. We tend to eat, even use cooking oil that is good for your heart. What about your brain? The day brain fails, nothing else, no other organ can work, because brain is the control organ. I tend to tell people that there's so much that, people need to get educated, not just about anxiety and depression. Let's go back to basics about how important brain health is. What kind of foods are important for brain. We all know what foods are good or not good for our heart, I'm sure. Like my grandparent also is very educated, that, she says that eating, this particular thing is good for your heart, etc. But nobody, this is good for your eyes, it has vitamin A, da 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 da, etc. But nobody talks about brain, right? So I think that awareness is important for sure. So yeah, I think being there and asking them if they need to see a doctor, and they'll come along, because first time seeing a psychiatrist is stigmatized somehow in India. right? I mean, the when I had to go to a psychiatrist, I felt very scared. When I had to go to different doctors, I never felt so scared, other than when I was getting injected, right? Probably as a child. But to go and see a psychiatrist, I thought, oh, do I have to disclose some personal details? Because the questions are not going to be, do you have cold, a cough, or fever? They're going to be very, they can be little personal, right? Um, so going with them would be a good idea. Also, I was telling, for the Raksha Bandhan, as simple thing is, gift your siblings a mental health checkup, right? Something like that. You think individually about your mental health. A lot of people are gifting people oximeters and masks, etc. for COVID, isn't it? The same way, why can't you gift them things for mental health? Like why can't you gift them superfoods? You can Google superfoods. There's going to be some nuts, there's going to be some seeds. Why don't you gift them that saying that take care of your mental health, we love you, or something like that? So why don't we promote? I'm not saying you need special highlighted mental health, but as much as physical health does, because it deserves same attention, if not more.
Yeah, I think that's a fantastic message there. And I think gifting someone, just like a first consultation, or just being supportive to them and saying, hey, you know what, I think you'll be fine. Or, hey, I'm here for you if you want to go check this out. I'm here if you want to talk about how it went. But, this is the reason why you should definitely go ahead. So yeah, I think that's a great idea to maybe give someone's give. I think multiple locations in India where we'll be able to do that. So definitely look into that, guys. All right, so I know we're coming to the end of our time here, so I have a last question. So, Dr. Charan, you've studied neuropsychiatry, and you sort of know how the process works, being on the other side of, being a doctor and talking to patients about what they're going through. So I'd like you to shed some light on why consultation is important. I think both from a biological sense, as well as I think from a treatment standpoint, from a person feeling better standpoint. So I think from like a customer or from an audience standpoint, because again, I think we're really hoping to drive the core concept of really seeking help and the advantage that it can bring to your lives.
Imagine you have a vehicle, let it be a car that you like, right? I mean, it needs fuel, it's not going to just run by itself. Buying a car is not good enough. You need to regularly invest into fuel, diesel, petrol, electricity, or whatever it is. The same way, your body is run by hormones and brain is run by neurotransmitters. Neurotransmitters, we call them chemicals, neurochemicals, brain chemicals in layman's language. You all know that, whenever the insulin levels are low, you tend to become diabetic. So immediately you'd go and see a doctor. We check your sugar levels and see they're high. It could be insulin dependent, independent, whatever. We do the tests, and then we immediately would put you on insulin or the drugs that would facilitate the promotion of insulin. Right? That's the same way. Same goes for the mental health as well. Brain. If I'm thinking right now and speaking, if I'm listening to Nishi and answering accordingly, if I'm able to focus, pay attention, or if you're able to pay attention to what I'm saying, everything is run by neurotransmitters. Without neurotransmitters, you can't do these functions. That's when you see people with somebody who had a stroke or somebody who had a head injury, which is big, etc. They can't think and function properly. They behave very differently, etc. So when you have depression or anxiety or schizophrenia, whatever mental health condition you call it, it is the game of neurotransmitters. So, as a doctor, I understand that this particular area of the brain is concerned with your function and the levels have gone down. We would do a functional imaging, just like neurologists do a structural imaging. We do a functional imaging and understand that the function has gone down. Why has it gone down? Has it gone down because your thyroid levels are low? Has it gone down because your vitamin B12 is not there in your diet? Has it gone down because your hemoglobin is generally low? Or has it gone down just because you're under a lot of stress, mental stress? So or etc. There are many causes. We will evaluate all of that, and we will obviously, cater a tailor-made treatment depending on your age, gender, other medical conditions, your body weight, your other drugs that you're on for different conditions, and tailor-made treatment to be given. That's why consultations are very important. I mean, it might look like, obviously I'm saying this to obviously promote my branch, but that's not true. Um, uh, it is what it is. It's the same as going to any other physician or a cardiologist. They'll understand. If that's what we read for 11 odd years of our life, isn't it? We read all of that and we apply that onto the patients. Yeah. Am I back?
Yes.
Yeah. Sorry. My patients are very punctual. Did you see it's 5 o'clock and I get a call?
Sure. Thank
Yeah.
you,
Yeah.
Dr. Today's
So
session was very,
yeah.
very, so thank you for your
So
time. I appreciate it.
thank you, Nishi. So I think for that reason, you need to see a doctor to understand. I always tell see the doctor first because I will end up referring it to you to a psychologist if you need therapy, right? There's a big confusion about should I go see a psychiatrist, should I go see a psychologist? I think you should go and see a doctor because that's what I did too when I had depression. I went to a doctor. Doctor has assessed what are the reasons for my depression, and then he said that I would need both medications and therapy as well. And then he's put me across a psychologist. Right? I think this is how a proper functioning is, rather than just picking this or that because you're not the right judge to decide that. You have to see somebody. I always tell it's like you have a fracture, go see an orthopedician and let him fix it, let him give you some medicines to ease the pain, and then obviously he would send you to a physiotherapist who will help you get rehabilitated to normal functioning of your limb. It's the same way. So whenever I see people, should I see a psychiatrist or psychologist, or even doctors doing reels, when to see a psychiatrist, when to see a psychologist, you don't know till patient is in front of you. There is no hard and fast rule that these three conditions go see a psychologist, these three conditions come and see a psychiatrist. It's not like that. See a doctor, get understanding, and don't be scared that the moment you step into doctor's room, they'll pop pills into your mouth. That's not going to happen, right? You can always talk to them and tell them that understand the need of medicines. And if you think the doctor is not listening to you or didn't assess you properly, get a second opinion. Don't lose the faith in the entire doctors. That can happen to us. There are good doctors, there are not so good doctors, just like any other professionals. Yeah.
Yeah, absolutely. I think, seeking help in this case is something that's backed by research, is the point that we're trying to bring forth. I think Dr. Charan put out a great explanation of why it's needed. And I think on another aspect as well is just the customized therapy that will be provided to you, is important because I, as a friend, will tell you some things that I know, but I by no means am educated in medicine. Same way, with your family, your parents, your siblings, they are going to help you out, but that's going to be from a certain perspective. So I think in that case, it really helps to have someone who's a professional, who has studied this, who sort of knows the patterns, who can then come in and help you figure it out. So yeah, absolutely. If you ever feel the need to, do not hesitate. We will be putting out some resources through this week through our platform for you to get started, for you to reach out if that's something that you'd like to do. Yeah, so coming back, thank you, Dr. Sharan. I apologize, we went a little over time,
No, no.
but I appreciate your time today. Thank you.
Thank you, Nishi. Have a good day. Bye.
Yeah.